So I'm reporting now from the EHRA meeting in Barcelona in March 2018, and we just had a very interesting session on artificial intelligence. So tell us, with Andre Esteva from Stanford, John Crawford from IBM, you guys know all about this. What is artificial intelligence?
Artificial intelligence attempts to build intelligent agents that can perceive and interact with their environment. Sometimes that environment is digital, sometimes it's actually physical. And they typically leverage advanced machine learning techniques to take massive amounts of data and distill out insights that help them in perceiving and interacting with their environment.
And can you give us a practical example of where AI has been applied in your own experience to something in the world of medicine?
Absolutely. A paper that my lab at Stanford and I recently published demonstrated that you could build a computer vision algorithm capable of taking images of skin lesions and diagnosing them as accurately as board-certified dermatologists, particularly at identifying skin cancers versus benign moles.
Okay, so great for image recognition, as good as the dermatologist. So, John, you've been involved in AI with IBM. What's your take on this, and what practical examples are there of AI being used in healthcare currently?
Well, when it comes to AI, we tend to use the term IBM cognitive systems, basically the combination of artificial intelligence, machine learning, and a number of other attributes. And we're applying it to lots of different use cases, but the first one that we started working on was oncology, and the reason for that was that oncology is a very complex area, especially when it comes to treatment options. So we spent some time training our oncology system using some of the top oncologists from New York, Memorial Sloan Kettering. And now we're basically offering that as basically a trained expert system to help people make better decisions when it comes to what's the next best treatment for a particular patient.
So I think lots of cardiologists will understand decision support and have kind of basic examples of that in their own practice. So just to give them an idea, how does this differ in terms of magnitude, speed, sophistication from the simple decision support that we use in daily practice in our EMR, for example?
So this is really about taking very large data sets along with the case notes for the individual patient and looking at all the possible options rather than just a very limited subset of those, and then evaluating which would be the right things for the particular case. So it's really about being able to consume and to work with and extract value from much larger data sets than we as humans would normally be able to do.
So both of you are enthusiasts, very knowledgeable in this field. Medicine tends to be very conservative, slow to move, wants a lot of evidence, wants to know what's behind the screen in the black box. How do you think you can improve the dialogue with the medical profession about the opportunities and maybe the threats of AI?
I think that necessarily to get AI adoption in clinical practice will require the joint efforts of a number of different stakeholders in the community. Clinicians and other doctors, hospital systems, insurers, even policymakers. And I really believe that transparency in terms of what AI can achieve, its limitations, where it can work well and where it still needs improvement, will be critical to helping the community figure out how best to engage.
Okay. And John, what do you think about that?
Well, the way that we see it is this is not about replacing professions. This is about augmenting what they can do with the power of a cognitive or AI system. Transparency is really, really critical. It must be possible always to go back and to understand why these questions have been answered in that way. If you don't have that transparency, I think people will lose confidence in it. So unlike perhaps some other uses of AI in industry, this in healthcare and medicine, the idea of being able to look at the evidence for yourself and then to understand the reason for a decision is pretty critical.
And as you may or may not know, the European Society of Cardiology wants to get very active in this space. It's set up a digital committee, wants to encourage its associations to get involved in these discussions and not just always be responding to what people are developing, but helping. Do you think that's something the profession should be doing? Should we be supporting that? What do you think?
Absolutely. You should absolutely be supporting these efforts, and they're necessarily the types of efforts that the leadership needs to pull in order for them to become adopted. The technology piece is perhaps 20% of the work that needs to be done to really see this positively affect patients.
And John, your opinion on that committee?
Well, I'm very much in favor of it, as I'm going to be joining it shortly, but I think the artificial intelligence concept is is part of the whole move towards a new industrial revolution in a way, and therefore any industry that's looking to its future over the next 10 to 20 years needs to understand how this is going to change things for them. And so just having that foresight and be able to anticipate it and to prepare for it is absolutely common sense.
So, Andre Esteva from Stanford, John Crawford from IBM, thank you very much for talking to us. Thank you.
Thank you.